Well, like many of the speakers, I have multiple topics. Tomorrow, there's going to be a session on early diagnosis and guideline development for Egypt. And I would say that that's really a particularly interesting area, because here we are at this conference where you have speakers from around the world talking about cutting-edge care. Very exciting. We've made great progress. It's being presented here in the context of a country where most of that care cannot realistically be delivered to the women that need it due to cost and systems issues. And so I think one of the great important questions is how to address the disparities between what we know how to do and what we can realistically do in the setting of limited resources. This is true around the world. This is not unique to Egypt. This is true in the United States and underserved communities. But I think the question of how to deliver care in the best way, to do the best we can, I think is really important, and I'm excited that that's one of the topics at this conference. Well, as we look at breast cancer globally, there are two requirements to improving breast cancer outcome. The first is that we need to have the cancers coming in at a sufficiently early stage that the treatment is likely to be effective. So we want the majority of breast cancers to be diagnosed as stages 1 or 2, but in the majority of low and middle income countries around the world, the majority of patients are diagnosed with stage 3 or 4. And we know that with locally advanced or metastatic cancer, it's hard to improve on outcome even with all of the resources that are available. So that first step is downstaging disease. The second step is to provide treatment, because if you find out that you have cancer but you don't treat it effectively, all you're doing is giving bad news earlier. That early detection only works when it's followed by appropriate therapy. And so how to get these therapies, especially the drug therapies, to patients is an important question. And it's not just, did she start the drug therapy? A really important question is, did she finish it? Because if you only do half of chemotherapy, then you get the side effects without the benefit. So some chemotherapy is not better than nothing. You have to address this. And so I think these, how to do early diagnosis combined with effective therapy taken through to completion, this is how we're going to improve on breast cancer outcomes globally. Well, I think we're hearing about exciting new drug therapies. There are conversations about immunotherapy, which is really exciting and outrageously expensive. And so it's really neat to hear about it because of the biological changes that are being made. You know, we're seeing with the HER2 positive cancers now, the Cleopatra trial is showing us that we can take patients with metastatic cancer, which used to be viewed as invariably fatal, and we actually are achieving cures. So what I would say overall is we're making a transition from thinking of breast cancer from an anatomic perspective, how big is the tumor, how many positive nodes you have. We're making a transition from that, which is still important, to a biological understanding. Is how do we do better with the estrogen receptor positive cancers? What are the CDK4/6 therapies? What impact are they going to have on this? How do we do better with triple negative? How do we do better with HER2 positive? So and that's all being presented here. It's very exciting to see such a great forum presenting here in Cairo. I'm really excited for the improvements in outcome, and I just hope we never lose sight of why we're doing this, because this is really about the women. We can make great advances, but until we actually deliver those therapies to the women, we are not going to succeed in changing the numbers. And that includes understanding why women will or will not accept therapies. In many places in the world, women won't come in for treatment because being diagnosed with cancer is something that they view as bad for their family, viewed as a hex, as a disease. Their daughters can't get married. We really have to understand not just the biology, but we have to understand the cultural and social environment in which this is happening. Because just because we build it does not mean they will come. So let's not forget the women.